and welcome back to my channel. My name is Esli and I have another pregnancy update for y'all. We are so far along. Who would have thought, right? Like who would have thought that we were gonna make it this far? Like I would have never dreamed or imagined that I would be at this point. But it is, I'm 35 weeks now, but my update is for the completed week. So it's from 30 to 34 weeks. Last I saw y'all on here, I was 29, or I had just turned 30 weeks, I think, in that video. But is there like, is that a shadow from, looks like it's my hair. Yeah, no. I'm like full on, look at me, like kind of greenish, and like my fall decor is out. Like I have in full fall mode. It is totally summer still here. I'm in Texas, Central Texas, and it's like probably in the mid 90s right now, but we had a day last week that it was like in the 50s, so that's when I was like, okay, I'm ready. Fall, it's fall time. I have like fall candles out. I put up like Halloween decor. I took out like fall things, and it's just full on fall here, y'all. Full on fall. Also, I wanted to get everything out just in case baby decides to come at any point. You know, she could come any day. So I just wanted to make sure everything was already set and I didn't have to like think about that whenever, you know, we came back from the hospital, because like holiday decorations just make me happy, y'all. Like I knew I wanted to have them. So anyway, that's a whole nother thing. So I have an update. Like I mentioned, we've had some really amazing days, some really wonderful days, and we've had some really crappy days, some really rough days, to be honest. But we'll go ahead and talk through them all. So I'm gonna go ahead and start. So last time you saw me, like I mentioned, I had just turned 30 weeks, and that week when I, you know, my 30th week, I had an appointment with my OB. So I get to the office, you know, get to the doctor's office, and the first thing I notice is like right at the front desk, like as I'm checking in, there's like a paper with a big picture of my OB, and it says, you know, Dr. such and such is no longer gonna be in this office starting August 31st. And I was like, that's weird. But I know she's actually like sees patients in several different offices. So I figured, you know, it's just maybe like it's just this office that she's not going to be in anymore, which, you know, is fine. I was thinking like, oh, I'll have a longer drive, but that's totally cool. Well, I get into my appointment, you know, start talking to her, and she starts telling me how she got like a career opportunity that she just couldn't pass up, and that it was something that was really difficult for her. But ultimately it meant that she gets to spend more time with her daughters, and you know, all these things. And obviously it sucks for me, but you know, it's great for her and I'm happy for her. And you know, I was kind of thinking like, well, it's fine, like I'll just follow you to whatever office you go to because you're my OB. I didn't like say that, but that's what I was thinking, because she kind of answered that for me before I even got to that. She said, like, the problem is I'm not going to be working for about 2 months. So she doesn't start her new job until after my due date. So there's just no way that she would be able to be my doctor. And I took it pretty hard. I took it pretty hard because who wants to have a new doctor for the last 6 weeks of their pregnancy? Now, when I was 30 weeks at the time, right, she had mentioned that she didn't think I was going to make it to 32 weeks just based on symptoms that I was having and how my stitch was looking and such. So she's like, you know, there's a good chance you might still deliver soon, in which case I'm still your doctor until the end of the month. And I thought, well, you know, obviously I don't want my baby to come soon, but if she does, then at least I know, you know, that I'm gonna have my doctor. Well, baby obviously is still not here. I did see my doctor, I think, one more time after that, maybe twice, I can't remember now. And then I met the new doctor, which I'll get into in a moment. But, you know, I was just really upset. I was really sad, and I got home and I called my mom. Obviously I had already talked to Luis, and you know, everyone's just telling me like, just be positive, like maybe, you know, this is the right doctor for you, and this is the doctor that God wants you to have, and the doctor that, you know, is supposed to deliver your baby, and those things, you know, could all be true. And obviously, you know, I do think God has a plan, and I know ultimately he's the one that's taking care of me and my baby girl. But it just, honestly, it just sucks. Like, I don't have any other way to describe that other than just really, it's just frustrating, because who wants a new doctor for the last weeks of pregnancy? Nobody, I don't think, especially when you really like your doctor, you know. So but anyway, around that time, I think I was probably around 32 weeks. I can't even remember anymore. I for some reason didn't write down the date. I guess I could check on the, I have like a collection. It's ridiculous, but I literally, every time you go to the hospital, like even if you're going into like emergency room or something, like they give you this sticker like with the date on it. And you know, like, because you have to check in, I guess it's like extra precautions because of the virus, you know, where they check your temperature and then they give you a sticker to say like you can go in. Well, I have like a collection of them up on my wall because we've gone to the emergency room so many times. I get home, I rip it off, and I'm sticking like in the restroom wall. It's ridiculous. Anyway, I could probably check the date, but I was just telling Luis, you know, I guess it was just time for our monthly ER visit, because I feel like we've pretty much gone to the emergency room at some point, like the labor and delivery emergency, once a month pretty much it averages out to, which is so frustrating. But anyway, around that time, you know, they had told me to do a kick count. If, in case you're not familiar, I'm sure you are, but in case you're not familiar, doctor says, you know, within an hour or 2 hours, depending on your doctor, they give you like a certain window, and they say your baby needs to move 10 times within that time frame. You need to count it, and you know, they give me a little sheet where I can write it down, and you know, baby's just supposed to move 10 times within that time frame. Otherwise, they say go to the doctor or go to the hospital. Now, I have this baby that is like, she's been kicking this whole time I've been sitting here. She is just a wild child. She is tap dance queen. She's just like, she is such a kicker. She's such a wiggle worm. She is just a very active baby. Very, very active baby. Well, usually it takes me like between 2 to 5 minutes to get to my like 10, you know, my 10 kicks count. And it was just some random day. I don't remember, like I said, the date, and baby just wasn't moving. I hadn't really felt her all day. I had felt like little small like rolls, wiggles, but no kicks, no, like nothing really like a defined movement. And I was kind of like, that's strange, but you know, I didn't want to overreact, and I didn't want to be that person, you know, it's just like running to the hospital for every tiny thing, because it feels like I have been, and I'm just so frustrated with going to the hospital. So I was like, you know what, it's fine. Like after I have dinner, she usually perks up a little bit after you know, after I eat and drink and things like that. So she'll, you know, I'll feel her later. Well, sure enough, have dinner, and I'm like laying around trying to do my kick count. Nothing. She's not wiggling, not moving, nothing. I tell Luis, you know, comes up and puts his face on my belly and starts talking to her, and which usually gets her like super riled up, because he'll like read to her or just talk to her every once in a while, and she gets all wiggly when she hears his voice. But wasn't working. Sometimes if I'm like watching a video, or if I have music and I have like my phone close to my belly, she'll like react to that as well. That wasn't working. Obviously I had just eaten, I had, you know, had some water. I walked around for a while. I was like kind of prodding and poking at my belly, and she just was not moving. And it got to the point where I started getting panicky. I started getting anxious about it, and I told Luis, like, let's just go to the hospital. Like, it's not worth the anxiety that I'm gonna have all day, all night long until she starts moving, you know, for us to continue waiting. And besides, you know, the doctor had already said, like, if you're not able to complete your kick count within that time frame, you need to go to the hospital. So we just decided we didn't want to risk it. Went to the hospital. They, like, you know, get me checked in. They put all those monitors around your belly. As soon as they did that, literally as soon as they did that, she started having a dance party. And I was like, oh my goodness, like this is so embarrassing. I'm like so frustrated. Like we're gonna be here for hours because you can't, once you're in there, like you can't just like walk right out, you know. So they're, and you know, and the doctor comes and tells me like, you know, it's normal, you know, moms come in here all the time when their babies don't want to move, but you know, sometimes decreased fetal movement can be a sign that your baby's in distress, so it's better to just double check. So, you know, they did an ultrasound and all of that. Now, the kind of weird good thing about this appointment was at 28 weeks, my doctor, so my cervix has been checked with every appointment. My cervix has been checked transvaginally, I might add, at every appointment that I've had ever since I've had my stitch. So they put a probe, like it's like a stick looking thing, and they put that into my vagina, and it's a little camera, and they just check on the stitch really quick, and then that's it. Like usually that part of my ultrasound like checkup thing takes maybe like 2 minutes, but it's been done at every appointment just to make sure my stitch is good, that it's not, you know, like tearing, or there's not any issues with it. Stitch has been okay. Once I hit the 3rd trimester though, they told me they're no longer going to be doing that because a risk of infection is higher, and then also once you make it to the 3rd trimester, I guess they're just kind of like, you know, the stitch is gonna, like, it's done what it's gonna do. There's not much like that, checking it is really gonna help at that point. So they stopped checking it, which was like kind of I didn't know that that was gonna happen, so I was like, oh, like I want to know like how my stitch is holding up, you know, just because I'm obviously constantly worried about it. But you know, it was fine because I figured, hey, like if the doctors aren't worried about it, well then I shouldn't be worried about it. But we were there at the hospital doing the ultrasound, and I asked the technician, you know, are you able to see my stitch like just through a normal ultrasound, like not like a, you know, not doing the transvaginal one? And they did one where it was like, it was down there in my, you know, area, but it wasn't like an internal probe. I'm sorry if this is like TMI, but I mean, if you're watching a pregnancy update, you're probably either pregnant or you've been pregnant, or so, you know, you get prodded and poked and looked at and just a lot down there. So it's just like a, you know, the same basically thing that they use on your stomach. They just put that on, you know, the top of my vagina, and they were looking at my cervix that way. And the girl was like, you know, I see you have a cerclage. Why did you get that? And I was like, oh, well, my stitch, or my cervix was opening, and I've been funneling this whole time, you know, down to my stitch. And she kind of looked at me weird, and she was like looking at the monitor, and she's like, you're not funneling. And I was like, oh no, I've been funneling. Like I've been funneling for months now. And in case you're not familiar, funneling just means my cervix opened, right? So there was like a piece, and then they put the stitch at the bottom. I only have about 1 centimeter left. So imagine like this is the bottom of my cervix. There's a stitch right here, and then I have 1 centimeter left past that. Baby's bag has been going into my cervix, so it's funneling into my cervix. And it's been like that since I had my surgery, since they found out that I had this issue. So she's like, no, you're not funneling. And she's like, and your cervix looks like it's completely closed. And I was like, what? Sorry, y'all, had to take a little break, but since Odin is here now, I wanted to give y'all a look. He just got a haircut. His dad gave him a haircut, which is why he has a few bald spots. Yeah, you have a few bald spots, don't you, baby? Oh, but I know some of y'all have missed seeing him in my videos. He's here, he's around. He is super duper extra clingy.
Just a sec.
Siri thinks I'm talking to her, I'm not. I feel like, especially in the last like 2 weeks, which has been like concerning me, because I'm like, do you know something I don't know? But he's been very, 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 very extra clingy, because he's already like super clingy. All right, baby, get down, get down, get down. Come on, baby. Go back on the couch. All right. Sorry, I gotta adjust. Okay. All right, things are secure. Yeah, we're good. All right. So saying that at this, you know, when I was in the hospital, that ultrasound technician told me that my cervix looked like it was closed and that I wasn't funneling. Now, because it's not a transvaginal exam, I don't know if I said this already, and if I did, I'm sorry. Because it wasn't a transvaginal exam, she said it's not as accurate, but she couldn't see any funneling. So I don't know, there's no way for me to confirm, there's no way for me to be sure, but if it's how it is, then, you know, thank God, and we're just, you know, we're hanging in there. But there's no way for me to be 100% sure of that. So next exciting thing, or like good thing that happened, I had mentioned to y'all, and I know I talked about this, I think in like an earlier video at some point, but I was, you know, being put on bed rest, and then with the pandemic, haven't really gone very many places. You know, every once in a while, if I just really need to get out of the house, I'll tell Luis, like, let's just go drive around a little bit. And I, you know, put my seat back a bit. I have a few pillows in there, things like that. But we just, you know, haven't really gone very many places. Now, and again, because of the pandemic, I didn't want to really go into any stores. We've been ordering our groceries. We haven't gone into any stores, things like that. Well, since the beginning, I was really bummed out that I didn't get to go to like Target. I just, you know, I can't tell y'all, like countless trips going to Target and just thinking, like, looking at all the baby things and just, you know, dreaming of like shopping around for all these things. And Luis would just tell me, like, you know, stop looking at that, you're torturing yourself, like, just, you know, quit, because we weren't pregnant. And now that I am pregnant and I couldn't get to go enjoy it, and so I had told Luis before I hit 32 weeks, because both doctors said I wasn't gonna make it to 32 weeks, I told them I want to go to Target just once. We'll go like super late at night, like right when they're about to close, so there's not very many people. We'll go like on a random day, or, you know, whatever, and that's Odin walking around, sorry. And, you know, I just wanted to try to make it as safe as possible, but I really just wanted to go. So we did that right before I turned 32 weeks, or maybe it was like that same weekend that I turned 32, I can't remember anymore, but oh my goodness, it was so exciting. I was just overjoyed because it was like, I know it's probably silly and, you know, whatever, but it felt like something normal, and it felt like, you know, something I really wanted to do. So it just, I don't know, it was just wonderful. I was so excited. I did post about it on Instagram. I'll put my Instagram handle here. I know y'all don't see me as much or as often on here right now, and that's just because I've been trying to avoid sitting for long periods of time, and filming, no matter what, you know, it always takes a while. So but anyway, I just noticed the blankets fell. I don't know when that happened, so I'm sorry. Now it's gonna bother me. That's better. So it just, you know, it was wonderful. It was just like a really happy thing. We made it to 32 weeks, which was another huge milestone. Like, I was just so excited because that meant most of baby girl's development was complete, I believe. You know, obviously things are still changing and growing, but the risk of her having any issues at birth decreased substantially at 32 weeks, from what I've read online. You know, I'm not a doctor, but just from what I've read. So I was just so excited that we made it to 32 weeks. That was like, it felt like a huge milestone, and honestly it felt kind of like a stick out my tongue to my doctor's moment, you know, kind of thing. Maybe more than stick out my tongue, but especially to that first doctor that told me my baby girl wasn't gonna make it. It was just like a really good feeling, to say like, hey, I'm beating the odds. My baby girl and I, we're making it. We're doing this. We're beating the odds. It just felt so great. And then after that, so once I hit 32 weeks, I had been told that my doctor told me once you hit 32 weeks, you can ease up on your like restrictions as far as your like bed rest, right? So it wasn't like, I was never on full on like can't move bed rest. It was always modified bed rest. So I was able to like putt around the house a little bit. They just told me to take it super, super easy. But she said once you hit 32, because you're kind of in a safer place, you still want to take it easy, but you know, you can do a little bit more. So we kind of took advantage of having a little bit of freedom. And again, because we keep thinking, you know, baby girl's coming any moment. I mean, she's technically still can. At this point, I'm pretty confident we're gonna make it to when my stitch is removed. But we'll see, you know. So Luis decided that we should go on like a little weekend getaway. You know, we didn't get to have like a proper baby moon, which we really were hoping for, but obviously with everything going on in the world and plus the bed rest, it just wasn't possible. And we had thought about going somewhere, but then, you know, it's a risk, right? Because of everything going on right now in the virus. And so we just hadn't really even thought about it. It was kind of just one of those, it is what it is type of things. But Luis actually booked us, like it was like an Airbnb bed and breakfast kind of place. It's a little cottage out, I will pop in some pictures, a little cottage out in the middle of literally nowhere. All I told him is I don't want to be more than an hour away from our hospital, just in case there's an emergency, my water breaks, I start bleeding, something happens. I just want to make sure we are able to make it to our hospital. So he like looked online and found some places, and he wanted to go somewhere like really dark so that we could, you know, do like our stargazing thing. And, you know, we took our telescope and he got some super cute, he got this beautiful picture of us. I will put that one in right now, of him kissing my belly, and you can see the Big Dipper in the background. And oh, it's just so beautiful. It's such a beautiful picture. It was just a wonderful little outing. We were alone on the farm. It was I don't know if I mentioned, but it was a little cottage on a big farm. It was like a 60-acre farm. There was like 2 other little like houses or cottages there, but we didn't see anybody except for the lady that owns it. When we first got there, she greeted us, you know, from maintained distance, and it was just really lovely. It's just so peaceful. It was so quiet. It was just perfect. It was so, so wonderful to have that experience. And, you know, it was just amazing. And then came time for me to meet my new doctor. And as I mentioned, I was really trying my best to stay positive about it. And I was, okay, I'm gonna try not to cry. Trying to look at it in a way of, you know, this is for the better. This doctor is gonna be great. I'm gonna feel so comfortable. You know, like I was just like kind of telling myself all these things about like how good the experience is gonna be, and this is exactly what is supposed to happen, what's meant to happen. And, you know, I was just trying to be like really positive about it. And I met my doctor, my new doctor, and she walks in, didn't even ask me how I was feeling. Didn't really ask me anything. She asked if baby was moving okay. I said yes. She said go ahead and lay down. She checked baby's heart rate. She said, all right, well, I'll see you in 2 weeks for your cerclage, to get your cerclage removed. And that was basically it. I mean, she said like a couple of other things, but that was basically it. And I had all these questions, but I was in like such a like, you know, like whirlwind of her just like blah, 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 like telling me nothing basically. And then she just opens the door, and I'm still just sitting there, and she's like she like gestured towards the door like, okay, we're done. And I blanked, and I should have stopped her, and I should have said like, hey, I want to talk a little bit. But I froze, I blanked, because I was so confused by the awkwardness of it all. And I got to my car and I just started bawling. I started bawling because I'm literally like, I met her that day. Next time I see her is when my stitch gets removed, and then next time I see her after that will probably be if, you know, she's in the hospital when I deliver. So And I called Luis, and I called my mom, and I know that everyone is just trying to stay positive and everyone's just trying to stay calm. But I'm getting to the point where it's so frustrating to just be told like, oh, just look on the bright side, it'll be okay. Like, and you know, I talked to Luis about it and he understands. But I told him like, I feel like I just rather someone acknowledge that this is a crappy situation, and that everything that's been happening, not everything, obviously, I still have this baby girl and that's everything, right? Like, that's the only thing that matters. But all these random things that have been happening, they're just crappy, and I just rather have someone acknowledge that and just say like, hey, you know what, yeah, it sucks, but you will get through it and it will be okay. And I just rather have that instead of like, be positive, like this is okay, you know, like I'm tired of that. Like my brain can't be positive anymore, and I'm trying so hard, but I'm just so like fed up with it. And I'm sorry, I'm not trying to be like Debbie Downer or be negative or pessimistic, but I'm just, sometimes it just, you rather just hear the acknowledgement, you know? Because it's hard to just, it's hard. It's just been hard. For the first several weeks, it's like, how can you stay positive when you're just literally going through every day thinking this could be the day I lose my baby? And then you finally make it to viability, and then thinking, okay, well, I made it another day, but you know, she's born now, she could have this issue or that issue or this issue, or maybe she doesn't make it, you know? And it's a lot on your brain. It's a lot. Maybe it's not on everybody, you know? Maybe I'm just not that strong. But it's just been a really hard pregnancy, mentally, emotionally. It's just been hard. And the whole change of doctor thing just really threw me, because I was feeling good and I felt like I was doing well, and then this just, it was hard. I had a few really hard days that week, because it was just crappy. I don't know what else to say about it other than that. The good thing about that, one positive thing, is that I do have my stitch removal scheduled now. It's gonna be removed on the 24th of September. So we have a couple of weeks here, and I'm really nervous. I'm getting very, very nervous about it. I'm very upset about it because, so whenever they put the stitch in, I had a full spinal. I was, you know, completely numb from the waist down. It's like a full-on surgery, like in the hospital. Luis was there with me, obviously not in like the operating room, but he was there like right up until I went into the room and right when I got out, more or less, except for he was like, I don't know, they lost him for a second, the hospital people. Now it's literally just gonna be at the doctor's office. They're just gonna go in there with the speculum, cut it out. She said she's gonna try to get it out, the doctor, is what she told me. So if it's embedded into my cervix, if there's some kind of issue, then I would have to go into the hospital. But since it's just at the regular office, Luis is not allowed to go with me. I don't get any kind of anesthesia, nothing. Like, they're just literally just gonna rip it out, and that's terrifying. I've talked to women that have had it done, and a lot of them say, you know, they didn't barely feel anything, that it was just really uncomfortable, but it wasn't pain. Other women say it's like an awful experience and it hurt so much. So I guess it just depends on maybe like if it's embedded or not, the positioning, or maybe the doctor that's doing it, maybe your own body, like how it handles it. I don't know, but I'm very, very nervous about it. But it's scheduled, and that's amazing to me because I can't tell y'all again how many times I thought that we weren't gonna make it to that. So I'm grateful. I'm so grateful that, you know, we're almost there. We're so close. Like, it's just unbelievable how close we are. I'm so happy. And other things that have been going on, like not like medical kind of bigger updates, I have gone into full like nesting mode now. I know I can't do a lot right now. I get, that's another thing, I get tired in like 2.5 seconds. I mean, I will get winded like as if I just ran a full-on marathon, which I've never done. So I mean, obviously an expression. But you know what I mean? Like, I'll be like exhausted, like winded, and you know, it's normal. I just have a, you know, my lungs are compressed right now. I have a very large baby. That's the one thing I wasn't expecting. My baby's not like extra large or anything. She's actually in the 51 percentile, 51st, I don't know how you say that, but she's in the 50th percentile. So she's like right smack dab in the middle. She's like growing perfectly. I forgot to mention that, but she's doing great. She's literally, every time they measure her, she's like doing perfect, like right at her date. Everything has been perfect with her. But if you don't know, in case you haven't been following me very long, I lost about 50 pounds last year, and I have gained, I think I'm at right around 15 or 16 pounds that I've gained like back, but ever since I got pregnant. So I haven't gained like a lot of weight, and I was expecting, because I had lost so much weight last year, I kind of expected pregnancy to not really feel any different for me. I was like, oh, well, I'm gonna be used to the extra weight. You know, I just lost a bunch of weight last year. Like, I'm not gonna be as heavy as I was, you know, at the end of my pregnancy, as I was at the beginning of 2019. So I didn't think it would make that much of a difference, but no, this is totally different, because even though I've only gained back about, you know, 15 pounds, it feels like I feel heavier than I've felt my whole entire life. Like, I feel like I gained 100 pounds or something, like with how tired I am, how exhausted I feel. Like, my weight just shifts so differently. Everything just feels hard. Like, everything feels difficult. Any movement, like twisting in bed is like a whole thing. Just like getting up, it's just a thing, y'all. I'm just so tired. But you know, that's not an issue. It's just mind-boggling to me, because I really expected it to like not affect me, like the weight, because like I said, I've been bigger than this, like much bigger than this, so I just never expected it to affect me the way that it has. And then the only other thing that I've been dealing with, still with the dry skin, it has gotten better on my face. So I mentioned y'all, like I'm trying all these serums and all these creams, and like nothing was working. I was like buying things, using them for like a week, and like my skin would react funny, or using them, you know, 10 days or like 2 weeks, whatever it was. Like, I was trying to give them like a bit of a chance. I would end up returning things, or just like tossing, I don't think I tossed anything, but just like things that I, you know, that I already had, or like samples. I had a bunch of samples, and I was trying things that were like, you know, high end, like Tatcha and like Drunk Elephant, all these things, to trying, you know, things from Walmart, like, but my skin just was not cooperating. Like, everything was hurting. My especially my cheeks, it was almost like I was getting like rosacea, which I've never had, but my skin felt like it was sunburned. Like, it was like crackly and like gross. Like, I don't know, worst skin issues I've had in my life this pregnancy. I've never really had, I have pretty normal skin. I have like normal to dry skin, I would say, but it's just normally not this dry. I did finally get a cream that seems to be working. I've had probably 2 weeks now that I've noticed a huge difference. I think it's called First Aid Beauty. It was something I got on Sephora, but it was like one of the cheaper lotions. It wasn't even something that was like very expensive, but it's, you know, my skin is doing so much better. My hands are very dry, but I suspect a lot of that is just from like sanitizing my hands all of the time and things like that. I don't know. I don't know if that's related to the pregnancy or not, but we are getting there, y'all. Dry skin or not, we are getting there. We're almost to the finish line. Like I said, I'm 35 weeks now, but I just wanted to update y'all up through 34 weeks. I have my stitch removed. It will be 36, I'll be 36 weeks and 1 day, which means I'm hoping, depends how I feel, if I'm in a lot of pain or if I just don't want to risk sitting down, there's a chance that I might not do an update, like another update, because I would like to update y'all on how my removal, like the stitch removal went. If I'm feeling well enough for it, then I will film an update at 37 weeks, and that will probably be my last pregnancy update, unless it just doesn't happen. I don't know. There is also a chance that they could take the stitch out and I go into labor like right away. The chances of that are small, but there's a chance. So this might be the last pregnancy update, and the next video you see from me could just be like, oh, my baby's born announcement. So keep us in your thoughts. Please keep us in your prayers. I am getting very nervous about giving birth. I know it's normal. I know that, you know, it's a normal fear and anxiety for a lot of women, or probably all women, but I'm getting very terrified of giving birth to this baby, and I'm just hoping and praying and just praying that we both make it out of the hospital okay, and that everybody's okay. And I'm really afraid. I'm very afraid. That's just my nature. I'm a worrier, but I'm getting very anxious about, you know, having to push this baby out of me. So anyway, please pray for us. I would really appreciate it. That is gonna be it for this update. I know it was another long one, but thank you so much for sticking around. Thank you for following my journey. If you found my videos because of the like cervical cerclage, if you have any questions, please leave me a comment or reach out to me on Instagram. A few of you have already, telling me that, you know, you found me because, you know, you got diagnosed with incompetent cervix and you're kind of just looking for information online, which is exactly what I did when I first got, you know, when I first found out. And I know that there's not that many videos and not that much information, at least like, you know, kind of like a person, like, you know, someone talking to you about it. So please reach out. I'll be happy to answer anything as best I can. But anyway, that's gonna be it for this video. Again, thank you all so much for your support, your love, and I'm so grateful for y'all. Thank you so much. I will talk to y'all hopefully very soon. And keep an eye out, like I said, on my Instagram. That is going to be where I first announce baby girl when she's born. So make sure to follow me there. It's at inkeesli. I'll write it up on the screen again for y'all. But thank you all again so much, and I'll talk to y'all very soon. Bye, everyone. Take care.